Eyelid surgery. As we age, our eyes often look very tired, and it's one of the more common reasons that people come in and they'll say, I have a very tired, aged appearance, look stern, or people will say I'm angry. And so when you look at people's eyes, there are a number of things that we look at. You look at both the brow, the upper eyelids, and the lower eyelids, and that tends to be all one aesthetic unit. And so when people are coming in and they want kind of quote-unquote eyelid surgery, you have to determine, is it due to their brow, is it due to the upper eyelids or the lower eyelids, or some combination of all those areas. And so blepharoplasty surgery is one of the most common operations we do. And you can do what's called an upper blepharoplasty or a lower blepharoplasty. And when you do a upper blepharoplasty, what you are doing is you're removing some of that skin and fat on the upper eyelid. When you do that, I often will undermine up above the eyebrow and put some sutures above the eyebrow to stabilize the brow, and that's called a brow pexy. For the lower eyelids, you can take some skin and fat out through an incision on the lower part of the eye, or you can go through the inside of the eye to take that fat out. And it allows you to lift up and tighten that lower eyelid. So for lower eyelid surgery, what's called a lower lid blepharoplasty, there are really kind of a couple approaches that you can do. You can do what's called a subciliary approach, where you make an incision just underneath the eyelid margin, or you can do what's called a transconjunctival approach, where you go through the inside of the eyelid and you go and you remove some of that fat. Now, if you look at the eyeball you have the bony socket that the eye sits in, and then we have this fat that kind of cushions the eyeball. As we age, there's what's called the orbital septum, and that septum becomes lax, so that fat tends to bulge out as we age. And so when you do the blepharoplasty, you go and you can remove and or reposition some of that fat and release that dense attachment along the orbital rim that gives people what's called a tear trough, and that tear trough can give you an aged appearance. And so again, you can go through the inside of the eye, called the transconjunctival, or do a subciliary approach to try to tighten the lower eyelid up. So many times when I do eyelid surgery, I will also do something to the brow called a brow lift, and with brow lifts there are different forms of that. You can go right above the eyebrow and take some of that skin out. You can go in a natural crease along the forehead, or most commonly you'll go up into the hairline and you'll undermine down along the forehead and resuspend the brow. And that can get rid of some of the heaviness along the lateral brow, called brow ptosis and lateral hooding. And so doing that in combination with upper eyelid surgery can kind of rejuvenate the whole forehead and the upper eyes. And so if we look at a lady like this, she had a brow lift and she had an upper lid blepharoplasty. And you can see that all that fullness she has in her upper eye. And when you suspend the brow, you put it up into a higher location and you take off that skin, it really cleans up her eyes. She looks a lot less tired. She doesn't look angry. Eyelid surgery typically takes about an hour to 2 hours. If you do upper eyelids, we can often do those in the office. If you're doing upper and lower eyelids or more surgery, we'll often do that in the operating room. The eyelid skin is the thinnest skin in the body. So I always kind of joke with my patients, if you look at the eyes wrong, they swell. And so, we have a postoperative protocol to try to minimize that, but no matter what you do, you're definitely going to get some swelling around the eyes. And the first week you are socially unacceptable. It's going to look like, Mike Tyson kind of hit you with a punch. And so, the stitches with eyelid surgery are typically in about a week, then they come off. It's very important to use cool compresses and moist eye pads with this surgery, and use lots of moisturizing eye drops. And so we have a nice protocol to help out with that, but you have to be ready for the swelling that comes with that and the recovery. And generally after the first couple weeks, people are doing quite well. When eyelid surgery is done well, it looks very healthy, it looks very natural, and people have a very nice, refreshed look.